The COVID-19 pandemic has once again put the global scientific and medical fraternity to the test.
So although this is the fastest we have ever gone from a sequence of a virus to a trial, it still will not be any applicable to the epidemic unless we really wait about a year to a year and a half.
Over why the cure for COVID-19 is taking long.
We can't rely on a vaccine over the next several months to a year.
The heat of the race towards the cure for COVID-19 is not only causing sleepless nights for doctors and scientists abroad.
Our PhD holders, our scientists, our researchers. Kwa wakati wa coronavirus, nyinyi mko wapi? Are you sitting in the labs trying to come up with a cure for coronavirus or a vaccine? Ama mko tu nyumbani?
But also at home.
Ukiwa kwa uko nyumbani uko quarantine, wewe ni full professor and you can be in the lab. Shame on you. Shame on you. Shame on you. Get out. Get out. Go to the lab. Go to the university. Go everywhere. Enda pale chini uanze kumix matawi hapo chini ya nyumba yako. Do something to find a cure.
The Machakos governor taking a swipe at Kenyan scientists for being too quiet during the time they are needed the most.
My name is Dr. Joshua Urua. I am a medical doctor and I work with Bliss Healthcare.
But doctors in the country now say they are up to the challenge.
Do you think that's possible? Can we have Kenyan minds go sit somewhere in a lab and actually come up with a cure for COVID-19?
Well, I think Kenyans are brilliant. We have the minds. Unfortunately, research is expensive and research requires money. It requires labs that are actually equipped to do that kind of research. We don't have that kind of resources. Kenyans' brains are brilliant, but it's good rhetoric to say why are they not doing that, because in reality we do not have the facilities, the support to put the brains to work.
Yeah.
Dr. Urua says that we as a country are reaping the seeds of a poor governance structure and the management of the health sector.
While the rest of the world, China, when part of their solutions to this problem was to give us the genome of COVID-19, other people are thinking of this is the vaccines that we're testing and these are the drugs we're testing. For us, our problems are still at the basic level. Where are we getting nurses? Where are we getting doctors? Where are we getting masks?
So far, about 35 companies and academic institutions are racing to create such a vaccine, at least 4 of which already have candidates they have been testing in animals.
The viral genome was mapped in early January and shared globally, which enabled tests to be developed and vaccine research to start.
The family of the coronaviruses have caused 2 other recent epidemics. The severe acute respiratory syndrome or SARS in China between 2002 and 2004 and the Middle East respiratory syndrome or MERS, which started in Saudi Arabia in 2012. In both cases, work began on vaccines that were later shelved when the outbreaks were contained.